Time now to ask the expert. Here to answer your questions live on the air about colon cleanses is Dr. Natasha Bouillon. All right, our first one from Diane. I have seen so many viral TikToks advertising Miracle Moo for gut health. Would you recommend this as a gut cleanser?
Oh, that's such a great question, Diane. So Miracle Moo, it's actually bovine colostrum. So for people who don't know, mammals, after they have a baby or a calf, the initial milk that they produce is called colostrum.
Yes.
It's rich in antibodies and nutrients. And what some folks have done is they've taken this bovine colostrum, turned it into capsules, and they're selling it. So I think a lot of people think this is really great for my health, but the research shows that if you have a gut infection and take bovine colostrum, it might help reduce the duration of that stomach bug.
Okay.
But just taking it every single day on a regular basis doesn't actually have any benefits.
Oh, so you could be wasting your money.
You're just wasting your money.
It's not going to harm you, though.
It's not going to harm you. I mean, it's worth a try if you want to. It's unlikely to help your gut health. It's unlikely to be a good cleanser. But if you have a stomach bug and you take it, it might be useful.
Oh, okay. And I do see a lot of the bovine
Colostrum,
Yes,
yeah, a lot of advertising.
That is so popular right now. Okay, Haley says, what are some good supplements to take to improve your gut health?
Yeah, well, I'm glad you asked this because there are some supplements that do make a difference. Again, not for everyone to take, but for people who are going through constipation, magnesium is something great to take because magnesium increases the fluid in your intestines.
Right. Doesn't that help with sleep too?
It can help with sleep as well. And so
okay.
it can give you some regular bowel movements. And so that's a beneficial one. And then the other thing I tell people, vitamin D. This one's really interesting. There's some early research that shows people who have lower rates of colon cancer, they tend to have higher levels of vitamin D. Now, we don't know if you take a lot of vitamin D, is that going to prevent you from getting colon cancer in the future?
Okay.
But there is a lot of research showing vitamin D might be kind of a key unlock for lowering risk of cancer. So that's another supplement to think about.
That's good to know. All right, Bob in Scottsdale asks, are there any downsides to taking a glass of water with 2 teaspoons of psyllium at bedtime?
Yeah, so psyllium is it's soluble fiber.
Okay.
And so this is actually completely fine to take because soluble fiber can help give you regular daily bowel movements, so it is helpful.
Okay.
But the thing I tell people is if you just eat fiber, it has the same impact. So things like avocado, lentils, oats, if you just increase fiber in your diet, that will help give you regular bowel movements, but psyllium is completely fine to take.
And isn't food always the better choice?
Food's always the better choice than a supplement, so if you're able to get fiber naturally through foods, that's a better route.
Okay. Christy from Phoenix says, are there any specific herbs you can add to your food that improve gut health?
There are a couple, Christy. This is also a great question. Ginger is a wonderful herb. And so, you know, what we find with ginger is it helps decrease fermentation. So a lot of people will take ginger. It helps decrease things like gas and bloating. I think this is like a little remedy for people who have nausea, pregnant women who have nausea. Taking some ginger can decrease that nausea. Turmeric is another one. So it's a known anti-inflammatory. It can help with regular digestion. Here's another interesting one. So pancreatic enzymes, so digestive enzymes. Our pancreas makes enzymes and helps break down carbs and fats and proteins. Some people have gas and bloating because they don't have great enzymes. And when they take digestive enzymes, that can make a difference. And then I would say the last herb I recommend to people is peppermint oil. So peppermint oil, we know that it helps people who have IBS, inflammatory bowel syndrome. And so for folks who've got like issues with digestion, issues with bloating or gas, when they take peppermint oil, sometimes they get relief. So that's worth a shot. Again, all of these are not for everybody, they're just for specific conditions.
Right, and I'm just curious, the peppermint oil, I mean, do you just like squirt that on your food?
Yeah,
I don't know.
People will take like supplement drops.
Oh, okay.
And also it's different than actually just like eating lots of peppermint. So that's not the same thing. Peppermint oil, it's an extract, and so you can add it to your food, you can add it to drinks, but it's different than regular peppermint that people think of.
Interesting. Okay, thank you for clarifying that.
Yeah.
Irene from Chandler asks, how do you know if you need to cleanse?
Yeah, you know, and this is a good question to ask because there are people who say, look, I've got constipation, I've got some issues, maybe a cleanse will help me. And it's an important reminder that a cleanse, a colon cleanse, is different than something like an enema. So we've heard of enemas. Enemas is when you flush the lower part of your colon really gently. And some people do need an enema when they have constipation because it helps them generate their own bowel movement.
Okay.
Now, most people though don't need a colon cleanse. And so if you're wondering like, what can I do? Talk to your doctor. But I would say most people don't actually benefit from an overall vigorous colon cleanse. And remember, an enema is just a sprinkle of water, whereas a colon cleanse is gallons and gallons of water flushing through your colon. It's really not something I recommend to people. people.
Okay, one less thing to worry about.
One less thing
especially
to,
if you don't need it.
Yes, yeah,
Oh,
just
right.
eating healthy exercise. It always comes down to that.
Yes, I know, really. Natasha, wonderful info. Thank you so very much. Our